So one thing that may be confusing to people is the word pathologist or pathology in our title. So our official title under our certification and license is speech language pathologist. Sometimes when people hear the term pathologist or pathology, they assume that that means that we're treating you as if something is wrong. And that is not the case. Many people go by the title of speech language therapist or just speech therapist. And we really do focus, especially with voice therapy, on ways to promote your desired voice. And it's very client centered. And it doesn't imply that the way that someone is using their voice is, quote, wrong. We would help you promote and learn to use your desired voice within the physical constraints of your voice so that you don't injure your vocal tissues or the larynx when speaking.
So, like I mentioned before, some terms that you may see when you do a Google search or some terms that you find can be tricky to define. So we just want to go over these terms. So pitch is just how high or low your voice sounds. Intonation means how your voice gets higher or lower during speech. So when you ask a question, your voice gets higher at the end of it. Resonance refers to how air moves through your mouth and your nose. So sometimes you can have too much air coming out of your nose when you're speaking or not enough. Um, Rhythm is stressing and unstressing words during your speech, which is sometimes called style. Rate, not to get confused with rhythm, is just how fast or slow you speak. And volume simply is how loud you speak. So a few other things that we do work on would be nonverbal communication, such as posture and body language. Language, which is just general vocabulary, words that you use in conversation. General speech sound production, which is just producing individual sounds or breaking down words. And pragmatics is the fancy word that we use to represent social communication skills. So this includes many different aspects that we talked about, which include body language, expressing emotions using change in pitch, intonation, rhythm, and volume.